You may remember the story from last week talking about something the Quebec government wants to do to make sure that teachers in schools will now bear the responsibility of teaching those kids how to brush their teeth. There was a lot of reaction to this story when it first came out, mainly from people saying, wait a sec, this is something else we're now going to pile on teachers to have to do. And I've received a lot of text messages from teachers basically saying the same thing. So I thought we'd try to find out exactly what is involved here, how this program will play out. Dr. Michael WISEMAN is an associate professor in the Faculty of Dentistry in the Division of Community-Based Dentistry and Dental Public Health, and he's on the line right now. Dr. WISEMAN, thanks for being here.
Thank you, Aaron. Happy Thanksgiving to you.
Thanks, and the same to you. Can you explain this? Because to me, outside of the fact we're going to get teachers to get kids to brush their teeth, I really don't understand how this program is supposed to work.
Well, first of all, I got to say it's initially a good initiative to try to improve the public health of our children. However, there are a couple big howevers. When I spoke to a few of my patients who are teachers, they gave me some of their criticisms, which I'm going to say, then I got to tell you the dental criticisms. Firstly, they say that they have enough on their plate right now trying to help post-pandemic children who are already quite needy, and teaching and supervising their oral care is not really their responsibility. Following that, they said, yay, if you're going to let us have to brush their teeth, the bathrooms in their schools basically have 2 to 3 sinks. How you can get 25 to 30 students to do a 2-minute brush and be able to teach them during the day. And finally, they're already quite overburdened as it is. A lot of them are quite burnt out. A lot of them are leaving the profession, and young ones, seeing what these older teachers have to deal with, aren't entering the profession. So that's the teacher side. From my dental standpoint, okay, I feel that money should be provided to fluoridate water to help decrease the cavity rate. That's number one. Number two, when we look at what dentists are paid to treat children 9 and under the RAMQ program, currently we're not paid to teach oral hygiene to our patients. In addition to that, we're not paid to give fluoride to help prevent cavities to these children 9 and under. We're only paid to extract teeth or fill teeth, but we're not paid to save teeth. So already, I think the government has to change their whole guidelines right from the dental chair and go forward.
Okay, I'm a little confused here. So when you say what the RAMQ program pays out, right? So under Medicare here, when you're extracting a tooth from one of those children you just referred to, beyond just extracting that tooth or filling a cavity or whatever it happens to be, don't you share information on how to basically brush your teeth and give them a toothbrush? Like, do they not do that anymore? They give you toothbrush and toothpaste when you leave the dentist's office?
Oh, we do. We do it because that's our mission as dentists. But we're not getting paid for that. We do it on our own dime, so to speak. Okay. So we're out there, we're teaching kids how to brush their teeth, but we're not getting paid by the government for that. And the idea of providing fluoride, which, like, we use fluoride varnishes in a dental office that will help prevent future decay, that's not covered either. So we're paid to fill teeth, extract teeth, etc., but we're not paid really to save teeth and prevent cavities from actually occurring.
Okay, I get that part, and I understand the fluoride. And pardon me, I don't want to sound like I'm kind of calling you out on this, but honestly, when you finish extracting or filling someone's tooth, a little guy's tooth, how hard is it to show them how to brush? You say you're not getting paid for that. I can't imagine it's a very lengthy process, is it?
Oh, we do it, Aaron. I'm not saying we don't do it. We do it because that's our professional code, that we are dentists to help. We're oral physicians of the mouth.
But you ought to be paid for that, for the extra time? Is that what you're saying?
Well, I'm just saying that we should be paid for it just as well as anybody else should be paid for it. But we're not being paid for it, but we're doing it on a goodwill gesture as we as dental professionals.
Okay, so how is this going to, if you kind of outline the situation with respect to teachers not wanting to get involved, not because they don't want to, but because logistics don't really seem like this could work, how will this move forward then? Do you have any idea?
So far, I have no idea, to tell you the honest truth. The government, of course, as you know, they put up a lead balloon to see what's going to happen. And so far, we don't really know any of the particulars. Give you another good example is the federal program on oral care. We don't know all the fine nuts and bolts of that program yet, and we're the providers. And we haven't really been involved in that aspect of the program.
Okay, so is that the program where the government's going to introduce dental care for kids under the age of 12? Is that what you're referring to?
Exactly. And we don't know anything about that either. We don't even know if that's going to be covering preventive program, which I think is the way to go. Prevention is the key. If we can prevent cavities, fantastic. And I know the teachers, they also want to take care of the kids, but they have so much on their plate right now. I don't think they can handle it themselves.
Yeah, and again, it's just so weird because, you're right. The idea makes sense. It's obviously a good thing to do for kids who don't have this habit from their parents or can't do it at home for whatever the reason, to get them to do it. My first question, I'm sure other people have asked this as well, instead of, kind of foisting this on teachers, why not simply send in a dental hygienist or somebody who can deal with this, who has the experience to do it and knows how it gets done, and it would go a lot faster, I would guess, as well.
Well, I understand. Well, there are hygienists that go into the schools right now, but we're looking, according to the government, to do this on a continuous basis every single day. So the hygienists aren't going to see each classroom the whole day. There aren't enough hygienists in the program to go visit every school on a continuous basis.
You'd have to think at some point, once kids understand how this works, we don't have to have someone monitoring them every single day. Once they know how to brush their teeth, there's some level of trust, like on the honor system here, that you're going to be doing it? Or
I would hope so. I also don't know. I haven't heard how even kids in inner city schools who may not have the funds for toothbrushes and toothpaste, if there's any funds available for them to get brushes. I would hope so.
Although, and we mentioned this when this story first came up, I would think that if you're Colgate or Crest or whoever, you'd spend a pile of dough just in promoting your own products in schools because you want them to become customers later in life. So maybe that's not as big a problem as we maybe are making it out to be.
It's hard to say. These companies, they have their own bottom line too, Aaron. We also know that if you want to improve the oral care of a patient, you got to try to provide the care of the provider, i.e. the parents. If they don't feel that oral care is important in their own books, they're not going to go and promote it to their children as well.
So one last question with respect to what the Fed program is going to do when it kicks in for kids under 12. Your understanding of that now, we all basically have the same information. You're saying you haven't heard anything new since it was introduced. You will have to provide free dental care to kids under the age of 12 beyond a certain income level for their family. Is that how it would work?
I don't know. I wouldn't call the word free. We're going to be remunerated for our care.
Well, the parents won't have to pay.
No, parents won't have to pay, no. And I think it's only to a maximum. So I don't know what aspects of that program will be covered. Will it also only be drill and fill and extractions, or will prevention such as fluoride and prophylaxis, which is the cleaning of the teeth, will also be covered?
Okay, well, a lot of ifs, ands, or maybes in this whole program. With respect to what's going to happen in Quebec, was there a date set for when this was supposed to start, as far as you know, the kids in school with the toothbrushing?
No, I have not yet heard a date.
Okay.
I think it's just their typical lead balloons, Aaron, and we're going to see what happens.
All right. Dr. Wiseman, thanks. I appreciate it.
My pleasure, Aaron.
Take
Have
care.
a great day.
I don't know about you, but I hear this, I'm like, we don't have a date for this. We don't have a date for that. We don't know how this is going to work. We don't know when that's going to start. We don't know what's going to be. How exactly is that a program? Wow.